Evening everyone, hello. Welcome to tonight's bonus session. As always, this week I'm just going to let Facebook just catch up, so there's not the usual time delay which sees me talking over myself. Hello everyone signing in, I hope everyone can hear me okay, all nice and clear, good reception, good signal. So, someone just give me a quick thumbs up. Hi Karen, hi Lucy, everyone hear me? All good? All good. Hi Jenny, hope you guys are all well. Thank you for joining me tonight. Hi Jeanette, I can hear you. Oh, brilliant, thank you. So I won't keep you too long tonight. I'm sure you're all sick to death of me. But I just wanted to talk a little bit about Marma therapy. Okay, so the week's been fantastic. We've had such a good week. It's been such a privilege kind of going through the week. If you saw the live video at 12, you'll know that the Ayurvedic Mentor is now open for recruitment. If you're looking to continue your journey into self-care, you're looking to learn more about Ayurveda, contentment, herbal medicine, if you're looking to maintain that kind of online community going forward, then check out the video from 12 o'clock today or check out the Ayurvedic Mentor. But tonight I want to talk about a really special subject, which is something called Marma therapy. Marma therapy. And Marma therapy is actually where acupuncture and acupressure originated from. When Ayurveda migrated across the Himalayas into Tibet and into China thousands and thousands of years ago, Marma therapy morphed into acupressure. So Marma therapy is pressure therapy, pressure point therapy to key nerve centers on the body, okay? And it's a phenomenally effective treatment. And it can affect every cell in the body. Your Marma therapy can affect our emotional health, our mental health, our physical health, our immunological health. Marma therapy will affect every single facet of the body depending upon what Marma points you're using. So there's 107 Marma points in the body. We're going to be focusing on just 5 of those tonight, based around contentment and swasthya and reducing stress and anxiety and kind of boosting energy and vitality and things like that. But before I talk about those points, where to find them on the body, and once we've found them on the body, how to treat them, I just want to talk a little bit about why and how Marma therapy works, both from a Western perspective and also an Ayurvedic perspective, because it's really interesting. Things like Marma therapy, acupressure, acupuncture has been dragged really heavily into the evidence-based arena. There's very, very clear Western evidence how pressure point therapy affects the biochemistry of the body. So from the Western perspective, we know Marma therapy works, acupressure works, because most of the key Marma points are located over dense nerve bundles or blood vessel bundles in the body. So by applying pressure to those nerve bundles, it's now proven in loads of different studies that it increases the secretion of our feel-good hormones, it increases the secretion of oxytocin, our natural opioids, our endorphins, and it reduces the secretion of our cortisol, our adrenaline, our stress hormones. So there's very clear evidence that Marma therapy, acupressure regulates the biochemistry and hormones of the body, and that's a very powerful thing, because if we think about everything we've spoken about this week, hormones are so integral to that. Our serotonin, our dopamine, our endorphins, our opioids, our oxytocin, all of our feel-good hormones, if they're working at the right level, we naturally feel more jubilant, more energized, more positive, more bubbly, particularly if our stress hormones are low. And pressure point therapy, Marma therapy, has the capacity to stimulate nerve activity in a way that facilitates those biochemical changes in the body. Okay, so it's really, really interesting. And there's lots more research around the way Marma therapy works from the Western perspective in terms of increasing blood flow, increasing nutrient delivery to the tissues, increasing the clearance of toxins from the tissues and the lymph. There's loads of benefits, but I don't want to dwell too long on that. I want to get into the actual nitty-gritty. But it's also worth pointing out how Marma therapy works from the Ayurvedic perspective, because it's similar in a way, but profoundly different. And in Ayurveda, Marma therapy is revered as a very, very powerful treatment. because it's energetically based. Okay, and in Ayurveda, in Chinese medicine, in most classical systems of medicine, the more subtle a healing modality is, the more effective it becomes, because it affects us at the energetic level. And Marma therapy, being exclusively a nerve energetic therapy, is revered as being one of the most subtle but one of the most profound physiology changing, emotional changing techniques in the whole of Ayurveda. And the reason for that is that Marma therapy and acupuncture, they work on, in Ayurveda it works on something called prana, and in Chinese medicine it works on something called qi, which are the same things. They're the energetic side of the body. And there's actually lots of research linking the concept of prana and qi to something called neuropeptides, which are a specific neurotransmitter in the body that fulfills almost exactly the same role that Ayurveda says prana is. And in Ayurveda, prana is our animating force. It's what brings life to the body. It's the difference between being alive and being dead. Like I said, I think I said earlier in the week, if you look at the death process, you're alive, and then suddenly you're dead. In the 1, 2, 3, 4, 5 minutes after you die, there's only one difference between the dead body and the live body. The difference, in the dead body, the organs are still fine, there's still nerve impulses, nothing's deteriorated. The only difference is there's no breath, there's no oxygen, there's no movement of oxygen through the body. That's what prana is. It's the difference, it's the animating, life-giving force that animates the human physiology, animates the mind. And the reason Marma therapy is so important is that if you think about anything that stagnates, will deteriorate. If you think about a fast-flowing river, really healthy. You think about a really stagnant, slow-flowing river, it's full of toxins, it's polluted, it's dirty. Think about the blood. If the blood in the body is flowing really well, it's nice and healthy. If it's stagnant, if it's coagulating, if it's pooling, we get illness and disease. And it's the same with prana. If the energetic system of the body is flowing well, it's the fast track to radical health. If the energy of the body is stagnating, if it's pooling, if it's not flowing, that's the equivalent to poor health or deteriorating health or disease. Okay, so helping and keeping the energy of the body, the prana of the body, flowing abundantly and freely through the whole physiology, through the brain, through the nervous system, through everything, keeps the body animated. And through keeping it animated, it keeps us content and happy and motivated and fit and strong and vital. Okay, so Marma therapy is working on that energetic system of the body, and what that then does through animating the body, through energy, through prana, it unleashes what is called in Ayurveda the inner pharmacy. So the body has, again, this is something that Western science, Western evidence is now absolutely proving, is that the body has this inbuilt inner pharmacy. It has within it the capacity to make its own natural version of virtually every pharmaceutical drug in existence. Anti-diabetic drugs, blood pressure drugs, immune system drugs. Our body has the capacity to produce its own versions of those. But it obviously produces them in the right dose, at the right time, in the right form, second by second, minute by minute, specifically to us, to where we are right now. Our blood pressure in the morning is very different to our blood pressure in the evening. By having an inbuilt pharmacy, it regulates that depending upon what's going on. We have this inbuilt pharmacy, and Western research is proving this concept in phenomenal ways. And what Marma therapy does, it provides the platform for the body to be able to unleash and mobilize its own inbuilt drugs to keep the body working from a place of balance. And there's all kinds of research to support this around the effects of acupuncture, Marma therapy on things like immune counts, inflammatory markers, hormones, blood function, liver function, just virtually all of the main systems of the body. And I find that mind-blowing. And the reason it's so powerful is that rather than inducing healing externally, rather than using treatment X to induce response Y, or using Marma therapy to lower blood pressure, it doesn't work like that. It's not cause and effect. You use Marma therapy, it energizes the body, it educates the body and informs the body to do what it needs to do to inform health. So it induces health, but not through an external force, but through empowering the body and allowing the body to unleash what it needs to regain and maintain health. So it's an educational, it's an informative, it's a very empowering treatment that allows the body to do what it wants to do. It gives the body the ability to do what it wants to do to regain health. And I think, if I think about the situations where we use Marma therapy the most, in cancer management, in more advanced cancers, more advanced illnesses, it's a key modality. In advanced illness, in any illness, the body has lost its intelligence. If you look at the Western understanding of a cancer cell, what is a cancer cell? A cancer cell is a cell that's lost its connection to the other 70 trillion cells in the body. And it's so lost and it's so terrified of being on its own, the only way it can maintain its survival is to keep on replicating because it's not part of the whole. And that's being applied to things like heart disease, Alzheimer's. It's a loss of intelligence. So Marma therapy is about maintaining the cellular, physiological intelligence of the body to allow the body to not get ill or to regain health if we are ill. And I think it's such a powerful, subtle, transformative treatment. And you can use it for anything, depending upon what points you're using, what herbs you're using, what oils you're using. But like I said, what I want to talk about tonight is how we can use a selection of Marma points specifically to around what this whole week has been about, which is contentment, swastha, peace, happiness, joy. Okay, and we do. So I know I'm kind of whizzing through this. So like I said on today's video, the next big series that we're releasing in the Ayurvedic Mentor is the full Swastha series. It's called Swastha, the Ayurvedic Path to Contentment, and we'll be covering Marma therapy in a lot more detail in the Mentor. In the Ayurvedic Mentor, we'll be going into the herbs and the oils and the full Marma maps in a lot more detail. So if that's interested, you can check that out. But tonight I just want to go through how we can use 5 main Marma points, and they're all super easy to locate. They're all super easy to use. So I want to talk about 3 that are specifically indicated for swastha, contentment, mood. I want to talk about 1 which is an animating, immune boosting, strengthening, vitalizing Marma point. Just because we've had quite a lot of questions in the Facebook group about fatigue and energy. And then one final one, which is to do with sleep and insomnia. Because again, we had a lot of questions about poor sleep and how can I optimize sleep and how can I regulate sleep. And there's a Marma point on the bottom of the foot called the Pada point, which is just one of the most evidence-based Marma acupuncture points on the body. And its ability to regulate and help with sleep dysfunction is phenomenal. I'll talk about how we did it with our kids in a minute. So there's 107 Marma points in the body, so there's a lot of them. But the highest concentration is in the head and the neck, for obvious reasons. That's where the brain, the spinal column, the brain stem, all of the key nerves obviously all join. And when it comes to swastha and contentment, there are 3 Marma points. There's 2 Marma points on the head and 1 on the chest that are just sacrosanct when it comes to swastha, contentment, those kinds of things. They're called Adipati, which is right on the fontanelle on top of the head, the Ajna point, which is the 3rd eye, and the Hridaya point, which is on the sternum. Okay, but it's really important that we locate them properly, because for them to work, we've got to be on the right place anatomically. Because if we're on the wrong place, we're not going to be animating the right nerves, we're not going to be animating the right blood vessels, we're not going to be animating the Marma point. Okay, so these 3 Marma points, you only need, so the reason I'm talking about these ones is it's really common in Ayurveda to treat those or to use them on a daily basis. You only need to treat them for 20-30 seconds per Marma point. So if you're looking at using those 3 Marma points, you may be looking at a minute and a half of time. So a lot of people will do them in the shower, after they've washed or whatever they're doing. They'll just before they finish their shower, they'll spend a minute just treating those 3 Marma points. You can do it before you get dressed. You can do it in the bath, you can do it before bed. It's just really good practice. It's really common practice to just stimulate those Marma points every day, because it takes such a short period of time. Okay. So the first one, the Adipati, is on the fontanelle, and the easiest way of finding that is if you draw a line from the heel of your thumb across to your little finger. If you draw a line across there and you place that line on your eyebrow, where the second, excuse me, I'm not spraying at you, but where the second finger lands in the center line of the head, that's the Adipati point. Okay, so line on eyebrow, where the second finger lands on top of the head, that is the Adipati point. And you can feel a slight divot there. There's a very, very slight sponginess that's different if you go an inch any other way. And so it's where the cranial plates on the top of the brain fuse. Remember when you have a new baby, you've got the fontanelle where you can see the pulsing. It's where the plates haven't fused to release pressure. And where they do fuse, because there's a join of the plates, there's a slight divot. And that's the Adipati point. It's right on the apex of the head, right on the top of the head. And the Adipati point is for it's peace, it's emotional balance, it's emotional regulation, it reduces stress, it reduces anxiety, it increases intuition, it increases peace, it increases swastika. So it's the crown chakra, it's the highest chakra. So it's all about emotional stability. So all you do, for all of these ones, once you found it, all you do is you just hold, you can use oils, you can use water, or you just hold it. Apply gentle pressure just for 20 seconds, ideally rotating in a clockwise direction. Okay, slow, gentle, clockwise strokes on the Marma point, just for 10, 15, 20 seconds. That's it. Just with enough, just enough pressure that you can feel it. There's no pain, there's no discomfort. Okay, so that's the first one. So you're in the shower, you're having your morning shower, or your daytime bath, or whatever it is. Before you get out, you find that one, you hold it for 20 seconds. The next one is the one everyone will know. It's the third eye, the Ajna, the Ajna Marma point, which is right. So if you draw a line across your eyebrows, if you place your first finger on that line, where the top of the finger lands is the third eye. Okay, so if you use two fingers, you can't really miss it. So it's right between the eyebrows. And it's one of the most powerful Marma points on the body. It's got, in the yogic tradition, it's got all kinds of energetic and kind of subtle benefits around extrasensual perception, intuition, all kinds of yogic almost superpowers. But it's also structurally linked to the pituitary gland, to the hypothalamus, to the key regulatory centers of the brain. And those centers are responsible for our emotional regulation, our stress responses, our emotional stability, contentment, swastika. And I think for me, looking at the way the Marma points work, that one is probably one of the most, if not the most important one on the body, because of what it does to us emotionally. And we've seen people using that who've going into MRIs, going into difficult surgical procedures, who having used it for a couple of weeks, they found it induces a level of calmness and stability that they would never have imagined pressing a Marma point in the body would have induced. Okay, so if you're feeling stressed, you're having a bad day, you're feeling really out of balance, just quietly sitting down, just for a couple of minutes and just applying pressure. Again, clockwise, slow clockwise strokes on it. You can almost feel the tension and stress melting out of you. Okay, if you do that every day, one, it's protective of not getting into those states, and it helps induce that swastika and that contentment. But if you are experiencing stress or anxiety, it can help to dial that down. Okay, so Adipati, Ajna, these three are easy because they're all in the center line of the body. Okay, so you're in the shower, in the bath, just about to go to bed, 20 seconds, 20 seconds. The third one is called the Hridaya point. Hridaya loosely translates as the heart. It's the heart space, it's the heart Marma. And the Hridaya point is that if you find your sternum, find your breastbone, keep on moving down, and you'll find there's a hole, there's a divot where the breastbone, where the sternum ends. So it's bone, 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 and there's where the bone ends, there's a hole right at the bottom. You can go, obviously you can go right through there. Once you've found where the breastbone ends, once you've found that divot, if you take 2 fingers, place it on the very bottom of the sternum, where that finger lands, that's the Hridaya point. Okay, so you can either find it really accurately and use a specific finger on it, or you can just use a couple of fingers and cover all bases. Okay, so it's the bottom inch, I suppose, of the sternum is the easiest way of describing it. And the Hridaya, it's used a lot in clinical practice for cardiovascular problems because it's linked to the heart, because it's linked to the nerve bundles that regulate the heart. You can use it to great effect for things like palpitations, arrhythmias, high blood pressure, angina, coronary artery disease, congestion, anything to do with the heart that's going wrong. The Hridaya point will help to strengthen, regulate, balance the heart. But in Ayurveda, well, I guess in every system, in poetry, the heart is not just a pump, it's the seat of our soul. It's got an emotional base, it's love, it's compassion. And in the Ayurvedic framework, the Hridaya point is empathy, kindness, gratitude, love, swastika, peace, humility, acceptance, non-judgment. Just a huge list of qualities that are just sacrosanct to going through life in a happy, bubbly, almost carefree way. It makes us kind, loving people. So those 3 points, they're all in the center line: Adipati, Ajna, Hridaya. 20 seconds, 20 seconds, 20 seconds. It's taken you a minute. So you've added a minute to your bath, or a minute to your shower, or a minute to getting dressed, or a minute to bedtime. Completely insignificant amount of time. But from an Ayurvedic perspective, from an energetic perspective, from a nerve perspective, from a hormone perspective, as you do it, 3, 4, 5 days, you get this accumulative gain. And I personally, for myself, I'll go through a couple of weeks and I won't do it for a variety of reasons. And then you start doing it again, and you feel it, you feel something. And it's and that's my experience of using it. We've taught students Marma therapy for decades, and that's their experience. It's the experience that we've found with people in clinic. Marma therapy works. It induces discernible changes in the way we feel, the way we experience the world, the way we see the world. And those 3, there's loads more. Like I said, if you want to learn a lot more, then check out the full series on the mentor, because it starts in the first week of March. Okay, so the mentor recruitment is open for a week, and then we shut the doors. So check if you want to learn more about, that's 3 points. There's lots more, but those 3 are really, really important. Okay, so super easy to find. Super easy to find, super easy to find. If anyone's struggling to find the locations of this, let me know. Maybe we can put up an anatomical map or something on the Facebook page. Okay. So those are the 3 that are specifically relevant to swastika, contentment, emotional well-being. I want to talk about one now, which is called Jatru, the Jatru point. Jatru, slightly different pronunciations depending upon the text you read. And the Jatru point is a vitality center. It's a vitality Marma point. It increases energy, it increases immunity, it increases resistance, it increases vitality at the physical level, but also the emotional level. So if you're run down, if you're immunocompromised, if you're fatigued, if you're tired, if you feel flat, if you feel blue, if you feel depressed, if you just feel like the life kind of force has been sucked out of you, the Jatru point is used to animate, strengthen, immunostimulate, vitalize, just to kind of really animate us, okay? And it's structurally linked to the thyroid gland. So it's something called the suprasternal notch. So if you find your clavicles and you keep on coming in, where the clavicles join, there's a really pronounced divot, okay? Which is right on top of the thyroid gland. If you then come down 1 finger width, okay, so find your clavicles, come into the middle, big notch, suprasternal notch, big notch in the right over the thyroid. And if you press in there, you're gonna actually touch the thyroid. So you don't want to press too much in there. But if you come down 1 finger width onto the right at the very apex of the sternum, that is the Jatru point. Okay, it's linked, and because the thyroid is one of the master glands, of the body. The thyroid is involved in virtually every function of the body. It regulates heart and immunity, and it's a master gland of the body. So applying pressure to the nerves and the fibers that support the thyroid, it has this very animating effect that affects the whole body. Every cell in the body, particularly the immunity, the immune system, the nervous system, the hormone system. It unblocks prana, it unblocks energy. So it's a really powerful animating force. If you think about where it's used clinically, people who've come out the back of chemotherapy who are emaciated and immunocompromised, people with ME, chronic fatigue syndrome, the wasting weakened conditions. But you don't need to be ill to benefit from it. You can just use it on a daily basis. Again, it's super easy. It's in the center line. So some people, you might add that one and make it 4 Marma points. Adipati, Ajna, the Jatra point, and the Hridaya. Okay, so you can add that one in. If you're feeling strong and really energized and your immune system's good, you might leave that one out because you might not benefit from it. But if you're thinking, well, actually, I do feel a bit flat or a bit tired or whatever, then for the sake of another 20 seconds, that one is well worth using. But what I want to talk about is that all of these ones we've spoken about using pressure. All you're doing is using dry pressure to stimulate the Marma point. But you can use herbal pastes to make the effect more powerful. Why do herbal pastes work so powerfully? Because if you think about, so I've got ashwagandha here. If you take ashwagandha orally, it goes into the digestive system. The digestive system breaks it down. The broken down products enter into the blood. Once they're in the blood, they affect the physiology. You can get the same effect through absorbing the compounds of the herb through the skin into the nerves and into the blood vessels. So anyone who's had morphine patches are delivered through the skin. HRT patches are delivered through the skin. Nicotine patches are delivered to the skin. They work by entering into the nervous system and the blood system. So anything you put on topically will move through the skin into the nerves and blood. So by using not just pressure on a Marma point, but herbal medicines, you've got a doubling up effect where the whole is greater than the sum of both parts. You've got the pressure, but then on top of the pressure, you've got these herbal compounds that are being absorbed into the nerves and blood vessels that are supplying the organs or glands or tissues you're trying to target, in this case the thyroid. So a really common one is that you use ashwagandha, both for this one and the next one I'm going to talk about, which is the pada point on the bottom of the foot. So to make herbal paste, you want to use the really strong, strengthening, energizing, tonifying herbs. Things like ashwagandha, guduchi, ginseng, rhodiola, tulsi, all of the really strong herbs. So ashwagandha is a great one, both for this one and the last one. So all you would do is just separate maybe 2 capsules of ashwagandha just by pulling them apart, like that. Tip it in. So this is a medicated oil. It's an Ayurvedic medicated oil. Again, we'll be covering all of this in the full series. All you do is add a little bit of oil, a little bit at a time, and you mix it together to form a really sticky paste that's made up of the medicated oil and the herb. So all you would do then, once you've made the paste, you want the paste so it's kind of not going to drip everywhere. So you can see it there. That's ashwagandha and a strong Ayurvedic herbal oil. So if you imagine that was the Marma point, just so you can see it, so there's a Marma point there in real life, so to speak. All you do is you cover that Marma point in the oil and the herbs, and then you apply pressure to that. Okay, so you can see, can you see that? You can see that there. So you'd apply, you've got the ashwagandha, the medicated oil, you could use a base oil, almond oil, sesame oil, over the Marma point, and you apply a lot of pressure on that in anti-clockwise strokes. And you might do that if you're going to go to the effort of using a herbal paste, it makes sense to use the Marma point for longer. So maybe 2, 3, 4 minutes, and the less energized that you are, the more emaciated, tired, fatigued, immunocompromised you are, the longer you hold it for. So you might hold it for, well, obviously you're using this one, but as an example, you might hold that for, 10 minutes or something like that. And within that time, you're stimulating the nerves with the pressure, but you've got all of those clinically proven, medicated constituents that are found and proven within ashwagandha or the herb you're using, transferring through the skin into the nerves, into the blood vessels, and animating the whole physiology in the same way that you do if you take it internally, orally. And if we're performing Marma therapy in clinic, we always use, well, most of the time, Herbal Paste, because it's the most effective one. Okay, and that combination. So the last point I want to talk about, just because we've had about 8 or 9 requests on the challenge Facebook page for regulating sleep. Okay, people not sleeping well or waking up in the night or whatever. And there's probably one of the most famous Marma points in the whole body is something called the Pada point, P-A-D-A. And the Pada point is right on the sole of the foot. So if you draw a center line through the middle of the foot, and then you divide the foot into 3 from the toe line. So imagine that's your big toe and your 5 little toes. If you draw a line across those, and then you divide the foot into 3, where the center line crosses the second joint, there's a div. You don't even need to know that. You can find it just by feeling it. If you move your finger around the sole of your feet, right on the arch, you'll find a really pronounced hollow, really pronounced. It's like a divot, and it's quite tender. If you press in there, it's quite tender. Big nerve bundle. Any reflexologists here, you'll know about that spot in terms of what it does. But in Ayurveda, it's linked, in terms of the nerve system and the nadi system, it's linked to lots of things, reducing stress and everything else, but it's functionally linked to regulating sleep, to limiting cortisol, to increasing the secretion of melatonin, our sleep hormone. And our second child, our first girl, was a shocking, actually they were all pretty bad, but she was particularly bad. It got to a point where we started using the Pada point on both feet every night, and within about 3 nights, she slept through for the first time. I think it was maybe at 4 months, 5 months. Holly will know that. But it's and it was just kind of mind blowing, and we use it all of the time. And if you're using the Pada point specifically for sleep, you want to use herbal medicines that help to calm and balance the hormones. So if you're looking to really enhance sleep, you might use something like valerian powder. You might get valerian root, grind it up, make a paste like that, and apply that. You sit cross-legged on the bed, apply it to both feet at the same time, which you can eat. It's super easy to do. Just as you're going to bed, just hold those for 5 minutes. Then turn off the lights, go to sleep. And the impact, I can't say with truth that it's worked with everyone we've used it on, because some people it hasn't worked, but definitely it's induced a significant gain in the majority of people, definitely. So if your sleep is bad, or you've got kids that aren't sleeping, I would use those 2 points. It takes a couple of nights for it to give you an accumulative load, but if you're using those, you definitely want to use herbs. You could use ashwagandha, you could use valerian root, you could use passion flower, you could use chamomile, ground up chamomile flowers. All of the calming sedative herbs are brilliant, and I can't recommend that Pada point. We use it a lot if we're not sleeping well or whatnot. We always use the Pada point. Okay, so they're the 5 Marma points that I think are most useful, based upon the comments we've had on the Facebook page and based around the series. So the first 3, Adipati, Ajna, Hridaya, for contentment, Swastika for peace, happiness, stress, etc. The Jataru point for energy, vitality, immunity, and the Pada point for sleep and relaxation and calmness, after about 9 in the evening. And that just gives you a taste. You're bearing in mind there's 107 Marma points in the body. Once you start learning about these, you've got this direct access to virtually everything in the body, every cell, every organ, every tissue, every problem, and it's so powerful in that subtle energetic level. I love Marma therapy. It's a lifelong learning journey. I can study it until I'm 100 and I still wouldn't know it all. It's a massive area, but I love it. It's a passion of mine. So if you'd, like I said, the mentor, do check out the mentor. I know loads of you have joined already. I hope you've got I think we had about 20 of you guys sign up to the mentor in the last couple of hours, which is brilliant. You brought so much energy and motivation and engagement to the group, and having you as part of the Ayurvedic mentor would be such a privilege. You bring so much to the group. So if you don't know what I'm talking about with the Ayurvedic mentor, check out the video from 12 o'clock today where Holly and I talk about it in a bit more detail. But the key point is that then we release a kind of a 6-week series every month. And the next one is the full Swastika contentment series. You know, we've scratched the surface with this challenge. There's so much more to it, and Marma therapy is a key part of that. So do check that out. But other than that, maybe before you go to bed tonight, just try it. Just bang, 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 and sorry, bang in here or there. Just try it. Just try it for a couple of nights. It's a profoundly moving treatment, and it's one that I love, and it's one that is really, you know, integral to Ayurveda and the understanding of the human body from the Ayurvedic perspective. So I hope that's been helpful. Thank you for joining me this evening. It's a pleasure to see you guys. And stay tuned. We have got a couple more bonus sessions coming up over the next few days to do with medicine making in the kitchen herbal medicine, a couple of foraging guides. We've got a brilliant closing ceremony when we close the challenge Facebook group down on the 27th. It won't be moderated, so we'll close it down. We've got a brilliant thing called a puja, an Ayurvedic fire ceremony, which is all about new beginnings and intentions that we're going to do, like kind of a group closing ceremony. So stay tuned for that. We've got the challenge has ended, but we've got lots of stuff coming over the week. So do stay tuned. But other than that, have a lovely weekend. Experiment with your Marma therapy. Try and keep the contentment rituals going. And I'll see you all soon for a couple more bonus sessions. Okay, take care, everyone. Have a lovely evening.